In this lesson, we are going to discuss about responsibilities at different levels. First of all, responsibilities between companies, and then move on to internal responsibilities inside an organization. Client is the party maintaining principal authority, and can be the orderer of the project, or owner of the property, where all these companies are working. Sometimes this company is being referred as the principal employer, or principal contractor. Anyhow, client needs to ensure that contractors will receive all the necessary information concerning the site. Client is responsible of coordinating the project, and will set the general rules that everyone at the site must obey. Client must also ensure that contractors have fulfilled their statutory obligations accordingly. This includes that contractor needs to provide documentation concerning pension payments, tax debt certificate, tax registration number for the employees, and organizing occupational healthcare. Client manages occupational safety, and also determines, for example, which are the general training requirements required for the site.
Site induction. Law requires site-specific induction and task-specific induction. This induction needs to be comprehensive and thorough enough. There is a good reason for that, as on a general level one could say that accidents tend due to human errors, and having the right information is a key element to reduce this risk. Even when you know your profession and your tasks very well, new environment could cause some unpleasant surprises. Accidents often happen to inexperienced persons who might not know what to do in certain situations and are still learning this new profession. When person does not yet know the work so well and also the environment is new, it increases risk level even further. Task and site-specific induction helps with this problem. On the other hand, accidents happen also to experienced persons who think they know better and sometimes fall into complacency plus neglect safety instructions because of this. Induction might help also with this type of attitude problem. People will then better understand why certain things are required on this special occasion. Site induction is statutory. Client must provide employees with all the necessary information concerning the site. Contents of the site induction is naturally totally dependent on the location, but very often this type of topics are included. Site-specific practices such as driving permits, speed limits, parking areas, social rooms. Required PPE, work permit practices, how to get one and who from. Contact persons, waste management practices, recycling. What to do in case of an emergency, meeting points, emergency numbers, location of fire extinguishers and first aid equipment. Site induction is not only important due to safety aspects. Proper inductioning will prevent people from making some practical mistakes as they know what to do in different situations. Induction can also reduce idle time, improve well-being and work satisfaction.
Lesson: Managerial responsibilities concerning safety. Safety in the workplace is not just a legal requirement. It's a leadership responsibility at every level. From top executives to frontline supervisors, each layer of management plays a critical role in ensuring a safe working environment. This goes pretty much so that top management is responsible for the big picture. Top management is responsible for the safety culture of the organization. Well, that term is a bit vague, but briefly it reflects how things currently are within that organization in question. Safety culture does not describe how things should be, but how they actually are at the present moment. Safety culture reflects current safety levels and performance, but also how safety instructions are implemented in the organization. Safety culture also reflects attitude towards safety, and does the safety culture favor risk-taking and even plain negligence. Safety culture reflects are things being done in the right way and so that safety procedures exist in real life and in practice. Remember, also attitude is very important. You can even argue that safety is a mindset. So top management will set safety goals and allocate resources to fulfill these goals. Safety goal needs to be something that can be achieved and measured. Setting the bar so that make it better does not actually mean yet anything, as counter question would be make better, how? Safety goal therefore could be like amount of incidents, amount of lost time, sick leave days due to incidents, accident frequency or something similar. For the sake of an argument, let's say that there is a plumbing company whose accident frequency last year was 24. This means that according to a mathematical formula it is counted how many lost time injuries took place per 1 million working hours. Average accident frequency in this industry is lower, so management takes this into account as one factor to make conclusions concerning their performance. A realistic and achievable first step could be, as an example, to set the goal so that during the next year they need to improve accident frequency overall and also to have smaller accident frequency as the industry has in general. Not easy but not impossible either to do it. CEO of the company has the biggest responsibility concerning overall safety as well as other directors through the line management. Okay, So top management sets safety goals, then what? Now it often moves a step down in the organizational ladder. To fulfill these goals, top management must show true commitment for this improvement project and provide support and allocate financial resources for it. Middle management will then usually try to make this happen. They implement safety policies into practice and try to find means to an end. They could, for example, apply enhanced work permit procedures to make sure people who do certain tasks are always qualified to do that task. As an example, that people who operate forklifts must have a personal driving permit to do so, and this permit is granted after certain skill demonstrations like completion of forklift safety training and a driving test. Middle management makes often also purchasing decisions on bigger tools and devices. So related to this example, maybe they would decide to replace the old forklift with a modern one that has better safety features as well than the old one did.
The supervisor has a very big responsibility. The working title describes the position already, so the supervisor needs to supervise that employees are performing their tasks according to instructions and also supervise the working environment and working conditions actively. The supervisor will make sure people are competent and skilled enough to carry out the task, whichever it is. Sometimes this means certain formal qualifications, like for example electrical installations and electrical repair work can be done only by an electrically skilled professional with electrician's degree and work experience. On other occasions, this qualification can be a bit lighter, and instead of years of studying, qualification could be obtained on a one-day safety course, like with a hot work operator who can obtain a hot work certificate with one training day. The purpose of this hot work training is simply to make sure that people who carry out hot work are familiar with the hot work procedure from start to finish. Then sometimes there is no formal qualification for that task in question. The supervisor can just use his or her own judgment by evaluating if the worker is skilled enough for the task intended based on worker's previous experience and skills. The supervisor will then give instructions for tasks and will need to make sure that these are also followed. In case of an incident, supervisor's actions are very often under investigation. Was there any negligence on ensuring instructioning, enforcing instructions, or overlooking the conditions happening with the work environment? Occasionally it has seen that silent acceptance of forbidden working practices or being too passive with supervision has enabled the incident to happen.
Then at the employee level, people need to follow given safety instructions, use required PPE, and keep all safety equipment, guards and warning labels in place. As an employee, you have a responsibility to work safely, and you can only do tasks in which you are qualified to do. We can only manage risks that have been identified, so remember that reporting deviations is very important. In case you notice a problem, do something about it. Anyone could remove this fallen mop from the passageway and lift it aside, but then if you see something else, like a broken electrical installation or a scaffolding missing safety railing or such, and you have no permit to fix these, do not do it but report it. As an employee, you have an obligation to work safely, but also the right to do so. In case the task under current conditions is dangerous, you do not have to do it. Then you report the deviation, for example, to the supervisor in question, and you would do the task only after this condition is fixed. Right to abstain from dangerous tasks is included with Occupational Safety and Health Act 2.
Occupational Safety and Health Organization. This is a cooperative organization which is developing safety conditions at the workplace. Often it is a part-time function where there are meetings few times a year, and members of this occupational safety and health organization have other work positions as well. This function will provide important information and support to the line management. Big companies then have a special OHS department with safety manager and HSE specialist. But that is another matter and not the occupational health and safety organization in this lesson. So for this co-operational function it goes as: in Finland, every workplace must have an occupational safety and health manager. This person acts as the employer's representative in occupational health and safety cooperation. This role plays a crucial part in promoting a safe and healthy work environment, preventing accidents and injuries, and complying with relevant laws and regulations. OHS manager role is mainly an expert role, and often OHS manager does not have the authority to implement these procedures automatically. This is important in the terms of responsibility. So OHS manager is not responsible for all the safety conditions of the workplace. Decision-making power defines the responsibility. In other words, In case the occupational health and safety manager did not have the authority to influence directly on some conditions and then something happens as line management did not follow up on the recommendation, OHS manager is not primarily held accountable based on his role. Legal responsibility is connected to the decision-making power also in general level. OHS manager was chosen by the management and then employees can elect the safety delegate. Often they vote who is their representative. Representatives are elected or appointed by the employees within a workplace or company to represent their interests and concerns related to occupational safety and health matters. The term of office is 2 years, unless otherwise agreed before the election. Occupational health and safety representative is also one good contact person in case you have some safety concerns you will like to issue. When organization size gets bigger, there can also be an occupational safety and health committee and then different departments, work shifts or different occupational groups could have their own safety representative or a safety delegate.
Then last topic in this presentation, occupational health care. Occupational health care is statutory function. The employer must provide their employees with occupational health care services. Purpose is to maintain employee workability and prevent work-related illnesses. Here the key word is once again prevention. In case we can identify certain risks, we can also manage them. For example, on noisy environment, usage of hearing protectors can prevent development of a hearing damage. Occupational healthcare will try to prevent problems and reduce the risks. They interview the employer and survey their working conditions and most typical work tasks related to their industry. Often, people also need to pass a medical examination for work. As an example, rescuing someone in time who has a heart attack from a tower crane, not to mention a wind turbine, is very difficult, and also time-consuming. Therefore, these operators must be physically in good condition, and cannot have an underlying health condition that could emerge while at work. In case some disabling health condition would also appear, possible solutions could be investigated together with the employer. Perhaps this employee is able to move into some other type of position, despite of this occurring health issue. Often before someone can sign the work contract there is medical examination. Occupational healthcare also conducts initial interviews and health checks, and will then give a statement whether the work applicant is suitable for the applied position. This makes sense. You would not want to end up in a situation in a confined space, with a panicking colleague who has a claustrophobia, or working in a shell, with a guy who is afraid of heights but thought he can master his fear. Occupational healthcare acts as a specialist. Service provider could be private or public doctor clinic for example, and the contents of occupational healthcare services are defined with a service agreement. Main function of this service is to prevent illnesses, and therefore they primarily focus on these type of operations, but agreement could also include other traditional healthcare services.